Ulcers are among the most underestimated and misinterpreted conditions in the world of digestive health. Many people brush off the initial signs, such as mild stomach discomfort, a burning sensation, or occasional heartburn, thinking it's just indigestion. However, what often begins as a minor irritation in the upper abdomen can quickly escalate into a serious medical issue. Contrary to popular belief, ulcers are not just surface-level irritations. They are actual open sores that form in the lining of the stomach, small intestine, usually the duodenum, or even the esophagus. These lesions occur when the protective lining that shields these organs from stomach acid becomes compromised. Left untreated, ulcers can lead to internal bleeding, bacterial infections, and in extreme cases, a life-threatening rupture of the stomach or intestinal wall, a condition known as perforation. The pain associated with an ulcer often serves as your body's final warning signal, urging you to take action before the condition causes irreversible harm. In this video, we will explore the true causes of ulcers, some of which you may not expect, the early signs and advanced symptoms you must never ignore, how ulcers are accurately diagnosed, the latest treatment options that can help restore digestive health. The goal of this video is simple: to educate and empower you with the knowledge you need to recognize an ulcer before it silently progresses, possibly endangering your life. Because the truth is, ulcers often remain hidden until serious damage is already done. But before we dive in, I'd love to know, where are you tuning in from today? Leave a comment below with your city or country. I always enjoy seeing where everyone's watching from. It creates a sense of connection, no matter how far apart we may be. And don't forget to like this video and subscribe for more wellness tips like these. What causes ulcers? Ulcers develop when the protective mucous barrier of the digestive tract becomes weakened or damaged. Under normal conditions, the stomach produces hydrochloric acid to break down food and mucus to protect the stomach lining from this acid. When this delicate balance is disrupted, either due to excessive acid production or reduced mucus secretion, the digestive acids begin to erode the inner lining of the stomach or intestine, creating an ulcer. One of the most common causes of this imbalance is a bacterial infection caused by Helicobacter pylori, H. pylori. This spiral-shaped bacterium burrows into the stomach lining, causing chronic inflammation. Over time, the inflamed tissue becomes increasingly vulnerable to acid damage. What's concerning is that H. pylori infections can remain asymptomatic for years, quietly damaging the stomach lining without any warning signs. Another significant contributor to ulcers is the overuse of nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, aspirin, and naproxen. While these medications are effective for pain relief, they inhibit the body's ability to produce prostaglandins, which play a crucial role in protecting the stomach lining. When prostaglandin levels drop, the stomach becomes more susceptible to acid injury, especially when NSAIDs are taken frequently or on an empty stomach. While stress was once thought to directly cause ulcers, we now know that it exacerbates existing ulcers rather than initiating them. Stress can increase stomach acid production, delay healing, and influence behaviors like poor diet or smoking, which all contribute to ulcer risk. Lifestyle habits also matter. Smoking reduces blood flow to the stomach lining, impairing its natural healing ability. Excessive alcohol intake not only irritates the stomach wall, but also increases acid production and breaks down the mucosal barrier. A poor diet, especially one high in processed foods and low in fiber, can further compromise gut health. One of the most dangerous aspects of ulcers is how easily they can be missed. In many cases, ulcers do not produce noticeable symptoms until they have already progressed. When symptoms do occur, they are often mistaken for common digestive issues like acid reflux or gas. The most classic symptom of an ulcer is a burning or gnawing pain in the upper abdomen, typically located between the breastbone and the navel. This pain may occur between meals during the night or when the stomach is empty, and is often temporarily relieved by eating or taking an antacid. But it inevitably returns, often more intensely. If the ulcer is located in the duodenum, the first part of the small intestine, the pain tends to lessen after eating. But if the ulcer is in the stomach itself, eating may actually worsen the discomfort. Other early warning signs include persistent bloating or abdominal fullness, frequent burping, nausea, loss of appetite, unexplained weight loss. As the condition worsens, ulcers can start to bleed internally, leading to more alarming symptoms. Vomiting blood or material that resembles coffee grounds. Black, tarry stools, which indicate the presence of digested blood. Pale skin, fatigue, and dizziness, which can be signs of iron deficiency anemia due to chronic blood loss. The most severe complication occurs when an ulcer perforates, creating a hole in the wall of the stomach or small intestine. This causes digestive fluids and partially digested food to leak into the abdominal cavity, leading to a serious infection called peritonitis. Symptoms of a perforated ulcer include sudden, intense, stabbing abdominal pain, a rigid, board-like abdomen, fever and chills, shock or confusion. This is a life-threatening emergency that requires immediate surgery and antibiotic treatment. The real danger of ulcers lies in how quietly they can develop. Many people ignore or misinterpret the early symptoms, resorting to over-the-counter medications or dietary changes without addressing the underlying cause. By the time an ulcer is diagnosed, it may already be bleeding or dangerously close to perforating. The good news: ulcers are treatable and often curable when caught early. Understanding the signs, getting proper medical evaluation, and making necessary lifestyle changes can prevent devastating outcomes. Identifying an ulcer goes beyond simply recognizing symptoms like stomach pain or indigestion. That's because the signs of ulcers often mimic other gastrointestinal conditions, such as acid reflux, gastritis, or even gallbladder issues. To accurately pinpoint an ulcer and determine its severity and location, healthcare providers rely on precise diagnostic procedures. The most definitive test is an upper endoscopy, also known as esophagogastroduodenoscopy, EGD. In this procedure, a thin, flexible tube equipped with a tiny camera is carefully guided through the mouth and down into the esophagus, stomach, and small intestine. This allows doctors to visually examine the lining of these organs, identify any ulcers, and collect biopsies. Especially important for testing Helicobacter pylori infection or ruling out stomach cancer, which can sometimes mimic or coexist with ulcers. In addition to endoscopy, there are less invasive diagnostic tools designed specifically to detect H. pylori, the bacteria responsible for the majority of ulcer cases. These include the urea breath test, a quick and non-invasive way to detect bacterial presence; stool antigen test, which checks for H. pylori proteins in a stool sample; blood antibody test, which shows whether a person has been exposed to the bacteria. While these tests can confirm infection, they don't provide direct visual confirmation of the ulcer itself or assess how much damage has occurred to the stomach lining. Imaging tests, like X-rays with barium contrast, may also be used, though they're generally considered less sensitive. They might reveal larger ulcers, but often miss smaller or more subtle lesions that an endoscopy would easily detect. What's often overlooked during diagnosis is a patient's medication history. Many people unknowingly increase their ulcer risk by repeatedly using nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, aspirin, or naproxen. These drugs erode the stomach lining over time, and if this use is not disclosed to a doctor, it can delay both diagnosis and proper treatment. Tragically, some individuals use these over-the-counter medications for years, unaware of the internal damage being done. By the time they seek medical help, the ulcers may have advanced significantly, complicating treatment and increasing the risk of serious complications like bleeding or perforation. Treating an ulcer involves far more than just soothing stomach pain. It requires a comprehensive approach to halt tissue damage, eliminate the underlying cause, and prevent life-threatening complications. If an ulcer is caused by H. pylori, the first step in treatment is eradication of the bacteria. Doctors typically prescribe a combination of antibiotics to kill the infection, paired with a proton pump inhibitor, PPI, to suppress stomach acid and give the ulcer a chance to heal. Medications like omeprazole or lansoprazole are commonly used and are highly effective at reducing acid production. For ulcers not caused by H. pylori, PPIs remain the cornerstone of treatment due to their superior ability to block acid. In some cases, H2 receptor blockers like ranitidine may also be used, though they tend to be less powerful. Antacids might provide temporary relief, but they do not address the root cause or promote healing of the ulcer. Another helpful medication is sucralfate, which forms a protective coating over the ulcer, shielding it from further acid exposure and promoting tissue repair. If the ulcer was triggered by NSAID use, discontinuing the medication is crucial, but this should always be done under a doctor's supervision. In patients who depend on these drugs for managing chronic conditions like arthritis, doctors may either switch to safer alternatives or prescribe additional protective agents to minimize gastric damage. While surgery is rarely needed today, thanks to modern medications, it can become necessary in severe cases. This includes bleeding ulcers that don't respond to endoscopic treatment, perforated ulcers, where a hole forms in the stomach or intestine, leaking contents into the abdominal cavity, gastric outlet obstruction, where swelling or scar tissue from ulcers blocks food from leaving the stomach. In emergencies, doctors may need to cauterize a bleeding vessel during endoscopy or perform life-saving surgery to repair a perforation or control hemorrhage. It's important to understand, ulcers are not trivial irritations. They are open wounds inside your digestive tract, vulnerable to infection, bleeding, and long-term damage. While ulcers can be healed, the greatest risk lies in ignoring the symptoms or masking them with pain relievers that only make the problem worse. Every year, thousands suffer serious consequences, not because the condition is untreatable, but because they waited too long to act. If you experience symptoms like burning stomach pain, unexplained nausea or weight loss, persistent bloating or burping, black, tarry stools, or vomiting that resembles coffee grounds, don't delay. These are red flags your body uses to signal serious internal distress. An ulcer won't just disappear on its own. In fact, it can deepen, spread, and weaken the digestive wall, eventually requiring emergency surgery if left untreated. Understanding how ulcers form, recognizing the early warning signs, and knowing your treatment options could very well save your life, or the life of someone you love. If you use NSAIDs regularly, have a history of H. pylori infection, smoke, or drink heavily, you're already at higher risk. So don't brush off that stomach pain as just heartburn. And most importantly, don't wait for it to get worse. Early diagnosis and prompt treatment are your best defense against irreversible damage. Let us know in the comments below if you've had any experiences with ulcers, or if you have questions we can help with. If you found this video helpful, give it a thumbs up and share it with someone who might benefit from this information. Don't forget to subscribe to this channel and hit the notification bell for more health tips. And thank you for watching. Your health truly matters.